Well, we might just get started. Welcome, everyone, on our event on a conversation on healthy placemaking. My name is Princess Ventura. I'm Regional Director for New South Wales for Urbis, for those of you who I haven't met before. Before we proceed, I just want to acknowledge the traditional custodians of this land and pay my respects to elders past and present. Today, I'm broadcasting from the Sydney CBD, which is Gadigal land of the Eora Nation. And welcome, everyone. Today, we really have a simple format where we'll hear from Fred London on his recent book on healthy placemaking. We'll have him speak about that for 20 minutes, followed by a panel discussion. I'll introduce the other panelists who will be joining him in that conversation. And just in terms of housekeeping, if there are any questions or comments that come to mind throughout the event, please pop them in the Q&A section at the bottom of your screen. Just type it in. We'll try and get through as many questions as possible. If there are questions that we can't get through today, we'll endeavor to get through those and get back to you after the event. And without further ado, if I can introduce Jenny Pry from Healthy Places, Southwest Sydney Local Health District, to introduce our keynote speaker today. Jenny, over to you.
Thanks, Princess. Good evening, good morning, everyone, from wherever you're coming from. I'm going to introduce Fred, and I just wanted to give you a quick introduction about healthy places in Southwest Sydney and our interest in healthy placemaking. So we're a part of the Population Health Unit of Southwest Sydney Local Health District, which is an operational arm of New South Wales Health. We are public health and health promotion specialists who identify as healthy placemakers. So by that, I mean, we want to ensure that health and wellbeing outcomes are built into all levels of planning, design, and the build of our local neighbourhoods, places and streets here in Southwest Sydney. So this obviously requires close working partnerships with our built environment practitioners, our policy makers, the development industry, urban planning and design consultancies. Southwest Sydney, some of you may know, and probably a lot of you don't, it's one of the fastest growing and culturally diverse districts in New South Wales. Pastures and paddocks are rapidly being turned into new airports, towns and suburbs. High density hubs are being designed around new transport links, or not, as the case may be. Car dependency has become the legacy of a sprawling landscape and large distances between our services and centres. So not only have our urban heat temperatures reached record new heights, we have among the state's highest rates of obesity, overweight and mental health conditions. And if all of that wasn't enough, Southwest Sydney now finds itself as one of the COVID-19 hotspots during the second wave. The connection and coincidence between all of these risk factors, I guess, will be the stuff of many future research projects. And in the words of Carolyn Butler-Bowden, who you'll meet this afternoon as one of our panellists, there has never been a better time to discuss the essential importance of healthy placemaking and prioritising health outcomes in urban planning. So this brings me to the very happy task of introducing Fred London, author of the recent book, Healthy Placemaking, Wellbeing Through Urban Design. Fred is an architect and was founding partner of JTP in 1995. His experiences range from the design of individual buildings to the master planning of large-scale sites, working on the concept design of major new settlements for the public and private sectors. Much of Fred's work has concentrated on sustainable approaches to development, resulting in his involvement with the EU EcoCity initiative, bringing together model projects throughout Europe. Now, this has led to over a decade of consultancy for the city of Tampere in Finland and invitations to present his innovative ideas about healthy placemaking at the WHO and UN conferences, focusing on how well-planned environments can encourage healthy lifestyles as well as slowing climate change. His extensive experience in this field has led to the development of his book that focuses on achieving health and well-being through urban design. So we're all aware that in modern day society, the main threats to public health are now considered avoidable illnesses, which are linked to a number of factors, but in particular are often caused by a lack of exercise and physical activity. Research shows that carefully curated architectural and urban design strategies can make a difference to the way we move, travel, breathe, feel, and connect. Practitioners have become increasingly interested in how they can make it easier for people to lead healthier lifestyles and improve their health through urban design. So Fred's book aims to address the multiple challenges we face in trying to make our cities, towns, and villages healthier. The narrative adopts a system of 6 distinct but interrelated principles of healthy placemaking, developed and honed over time in collaboration with JTP. So we're very much looking forward to hearing more about your work, Fred, and thank you for rising so early in the morning to share your thoughts and experiences with us here.
Thank you, Jenny. Fred, can we call on you to do your presentation? Thank you.
Yes. Am I muted or unmuted?
We can hear you. You're unmuted. Oh, you're muted now.
Right. Yeah, right. So I should be like this. And here's the first slide, which is great. So, well, off we go. Hello and good afternoon to you all. I'm delighted to have been asked to present some thoughts on this challenging topic. So thank you very much for signing up to this event, and thank you, Jenny, for that more than generous introduction. It's great that this very large audience consists of what Jenny has described as a wonderfully diverse mix of professional groups. So I'm hoping that you, as the audience, will find areas of interest and ask plenty of questions during the forthcoming discussions. Presenting a whole book's worth of healthy placemaking in 20 minutes is a daunting task of finding the balance between detail and overview. Guided by the event organizers, the main content consists of 6 placemaking principles and 7 health targets, which are sandwiched between background material to provide some context. So off we go. Next slide. So here's the front cover of the HEPA conference, Health Enhancing Physical Activity, and it is indeed health enhancing, and our unpredictable attitudes to health make it a very fascinating subject. That's why the HEPA conference was such an eye-opener, with all those workshops addressing obesity amongst children and ways to help older people lead long lives in good health. Next. Why are all these people standing up? Perhaps you know it's because standing up is good for you, physically and mentally. My talk in Helsinki was one of 4 half-hour presentations. When the facilitator asked them to stand up and applaud after each presentation, it was clear that the attendees were more alert than if they remained seated throughout the 2-hour session. I suspect we all know that kind of experience. Yes, we make good and bad choices all the time in our lives. The icons in this simple, perhaps simplistic diagram explore what we do or do not enjoy and what is or is not good for our health. On the top right is what I refer to as the fortunate group, who have fewer dilemmas as they enjoy living healthily. Top left, I'm calling the sensible group, who understand the advantages of keeping healthy, but don't really enjoy it. Bottom right is the your choice group, who succumb to temptation despite being aware of the health risks. And that leaves the no choice group, who don't enjoy doing the things that they know are bad for their health and quite possibly suffer from unacceptable exploitation. The next 3 slides summarize the medical angle. Our increasingly unhealthy lifestyles have alerted the world's health authorities to an escalation of avoidable illnesses. A disproportionate number of COVID-19 deaths have occurred amongst people who are already suffering from pre-existing health conditions, such as heart disease, respiratory illnesses, diabetes, or kidney disease during a more vulnerable, resulting in a more vulnerable immune systems. And being vulnerable to infections. But the key to healthy placemaking is to assume that not enough of us will follow the health advice on offer. Its focus is on measures that will help us to lead healthier lives without having tried to do so, or even being aware that we've succeeded. That's where urban planning comes into play. Next, here's the book cover and the list of 6 principles. I'm glad to say that the IBA publishers made a great job of the graphic design and the layout. And as you can see, the principles are urban planning, walkable communities, neighborhood building blocks, and a gap before government networks, environmental integration, and community empowerment. Next slide shows the principles coming to life with this diagram, showing how the 6 are interrelated as they cross over one another. The 3 scales of planning and the 3 linking concepts establish a matrix that demonstrates why connectedness and integration are fundamental to the ethos of healthy placemaking, and principles 1, 2, and 3 intersecting with principles 4, 5, and 6. I'll now take you on a brief tour of those 6 principles, and it is a brief tour. There's so much more information, but this is just a snapshot, really. So, starting with urban planning and the equitable use of space. There's this quote from the UN Habitat from 2013, which puts things into perspective. It's there on the screen, but I'll read it out. The perceived advantages of convenience, privacy, and status continue to make the private car an attractive means of urban transport. However, a considerable range of externalities arise from increased motorization of cities, thus dwarfing its benefits. So as regards the equitable use of space, although it goes unquestioned, I believe it's actually inequitable for people from outside towns to be permitted to park their private vehicles and leave them occupying space in the downtown before they drive them away again. The urban centre space is where permanent citizens are leading their lives. Many of them may not even own a car, and yet cars are allowed to be in their environment. The nearer one gets to the centre, the more valuable is the urban space. That's where public transport, cycling, and walking should take over, as shown by the colour-coded arrows, which I hope you can see them. The arrows are blocked by a chat line, I think, but it doesn't matter. Yes, having cars on the open road travelling at car speeds are not the problem. Those are the pale blue arrows that head off into the distance. But it's cars in the urban centres that are the problem, and that's the sort of, it shows all those arrows going into the centre. And the vehicles generate toxic emissions caused by their petrol engines, and fossil fuel and electric vehicles emit microscopic dust particles, it's hard to say that, released from tyres, brakes, and road surfaces. Next. Walkable communities, living locally. These diagrams are in Leipzig, Germany. The city's core is the main destination. You can see it right in the middle where it says city. But people's daily needs can be met by the many walkable neighbourhood centres without the need to drive. The 10-minute walk from their homes to shops, schools, and other public services will provide people with regular exercise as well as social interaction. I was very pleased to see this map of Leipzig. Next is neighbourhood building blocks. It's about supportive communities. Fruitvale in Oakland, California, is a Latino American quarter on a transit stop. Its social structure is remarkable for having resisted gentrification in San Francisco, one of the world's most, or the world's and UK's most overpriced cities. Sorry, USA's overpriced cities. It has this mixed-use central square that caters for people of all ages and from all walks of life. Movement networks, health prevails. In 1999, at a JTP planning event for a brownfield site, the citizens of Essen, Germany, showed their preference for a public park rather than the planned completion of the city's inner ring road. The dotted red line shows where the inner ring road was planned but never built. The solid red line is the existing road that was duly upgraded. And the green line is the pedestrian and cycle route connecting the university and the city centre. If you go on to the next slide, it shows Berliner Platz, as it's called, transformed with reduced vehicle traffic and direct connections on foot and by bike from the university on the left to the city centre on the right. And it's interesting that when we conceived this neighbourhood, we didn't think of it as a health project, but that is precisely what it has turned out to be because of the way the priorities got changed. Environmental integration, experiencing nature. Excuse me. The late evening promenade of the whole family in Warsaw's Łazienki Park. Even people unused to exercise will surely enjoy places as imaginative and as beautiful as this. I often think that the environmental integration principle is the one that is most welcomed. I think it's because people like greenery. There's more of that later. Community empowerment, standing up for our rights. There are many healthy uses for a public park, everything from peace to protest. Persistent community engagement and physical effort transformed Cal Anderson Park in Seattle from being a woefully neglected area to become a cherished local facility. Next. You've seen the next slide already, thank you, but now with a new title, Health at the Heart of Planning, which is the oncoming section that I'll be talking about. Next slide. The four coloured circles in EcoCity's diagram for sustainable master planning deal with typically practical issues. But take a look at the centre and you will see that its sole concern is to minimise impairment of the environment and human health and maximise mental well-being and community feeling. I think the fact that that is regarded as the most important thing, not the other practical things, is an interesting way to think about it, because typically we talk about money and lots of other things and more practical issues. So health at the heart of planning is my response to that ideal challenge, which is summarised in the next section. So this diagram sets out 7 of the most serious illnesses and hazards resulting from modern lifestyles. I'll just run through them. Mental illnesses, several forms of cancer. Oops, you've gone too far. Well, it doesn't matter, it's fine. Several forms of, well, there we go. Several forms of cancer, type 2 diabetes, cardiovascular diseases, respiratory illnesses, unhealthy diets, and vehicle accidents. Next, please. And what the targets are, the health targets, are clean air, contact with nature, social interaction, feeling safe, living somewhere healthy, peace and tranquility, and regular exercise. So here we go, starting with clean air, for which limiting emissions and sufficient distance of receptors from pollutions are the issues. Air quality in UK city centres exceeds World Health Organization standards. Public spaces, homes and schools require zero tolerance regulations on air quality, and limiting motorised traffic generates numerous health benefits. Addressing these issues cannot come quickly enough. It has been very interesting how the air quality issue has shot up the agenda, the health agenda. Next, contact with nature. Location of green spaces relative to homes and benefits of allotments and environmental protection. Got there just in time, thank you. Green-blue spaces must be integrated into settlements to prevent urban heat island effects and to control natural forces such as wind, rain, flood and fire. Research at Mannheim University, Germany, shows that the human brain has a naturally positive response to greenery, as I mentioned earlier. This destruction of our natural environments must stop for our own good as well as the planet's. Next one, social interaction, the attractive design of walkable public realm. Communication, thank you. Communication builds community and generates a sense of belonging, identity and civic pride. Lively streets, spaces and buildings can help people who suffer from loneliness and isolation. And time spent in the public realm enables local decision making and exercise in daily life. For as long as the virus holds sway, people will have to adapt to the constraints that this imposes of social interaction. Next one, feeling safe. Safe, defensible, sociable space, child friendliness and low traffic speeds. Fear of crime can be a disincentive to social interaction. People are afraid to go out. Good architectural and urban design have key roles to play in overcoming these risks. And designing child friendliness reassures parents as well as benefiting the children. We will never eradicate life's dangers, but we can find ways to reduce them. Next is living somewhere healthy. Active travel and walkable access to daily needs, including healthy food outlets and primary schools. The location and distribution of dwellings are central to healthy placemaking. Facilities need to be within comfortable walking distance from all dwellings, and houses and apartments must be of good quality internally and externally. The environment within which the housing is built is, of course, as important as the homes themselves. Next, peace and tranquility. Access to peaceful places and distancing from sources of pollution caused by noise and light. Environments to which we can retreat are a necessity, not a luxury. Mental unrest can have damaging effects on our peace of mind, and the hazards of established sources of noise, light, and other pollutants must be eradicated. This is based on neuroscientific research, which is revealing how much more we need to learn about these issues and the action required to overcome them. And the last of these is regular exercise. Quality of public spaces, safe walking routes, green spaces, and the benefits of environmental protection. Sedentary lifestyles increase the likelihood of contracting avoidable illnesses. Shops and primary schools within easy reach encourage walking as a natural choice. Active travel must be promoted, in other words, public transport, cycling, walking, scooters, and more. There are plenty of signs of progress here, but there's still a long way to go before it becomes the norm. So next is a table, which is a table of the 7 health targets, the same ones I've just run through. And as I said, on the right-hand side are the headlines that had been there that I was describing. And the point about the 7 health targets is that they overlap and reinforce one another from differing starting points, delivering a combination of primary benefits in black and secondary contributions in pale green. You can see that the number of horizontal and vertical lines of black and green dots are variable, with some having many entries and others only a few. Having more entries does not make them more important, but it does mean they cover more of the targets. This concludes the main content of this presentation, leaving some final reflections on COVID-19 and beyond, and then a brief summary. So the extent of the coronavirus's influence remains unknown, but some early effects are already becoming apparent, both negative and positive. Some less healthy directions are people fearing people fearing dense urban environments who flee to poorly serviced suburbs, facing instead the health risks of car dependency and the erosion of social networks. There's also the global economic recessions causing citizens to focus on their understandable short-term financial distress whilst paying scant attention to environmental issues. Some healthier directions: reductions in road traffic due to increased home working, rush hours becoming less busy, and increased walking and cycling in response to concerns about the risks of using public transport. And a natural trend towards healthier, more walkable neighbourhoods, generating higher patronage of local shops and increased communication with friends and neighbours. Next, climate change, which I believe is by far the biggest challenge. A negative angle are the less healthy with less healthy directions, which worsen the environmental damage and accelerate the climate crisis, as opposed to the positive, which is the healthier directions which preserve natural environments and slow down climate change. So as a very brief summary, the 6 principles and 7 health targets are a further example of concepts that overlap and do so from different angles, indicating the material has many facets. It's a complex issue. None of these concepts are silver bullets, but taken together, they constitute a wide range of ideas that allow for complex issues to be considered carefully in order to arrive at complete solutions rather than just short-term fixes, which are often the case. So it only remains for me to wish you your good health, next slide, to stand up and stretch, and thank you very much for watching. Thank you.
Thank you, Fred. And let's just welcome the other panelists to the virtual floor. Just a reminder to pop in your questions in the Q&A box down there, and we'll try and get to as many questions as possible. You can post your questions to Fred, the rest of the panelists, or to specific people on our panel. So first we'll welcome Caroline Butler-Bowden, who is the Executive Director of Public Spaces at New South Wales Department of Planning. Welcome. Patrick Harris has a really long designation, Senior Fellow at UNSW and Acting Deputy Director, Healthcare and Equity, Population Health, Southwest Sydney Local Health District. Like a 3-line. I got through it, Patrick. Welcome.
Yeah, you did well. You did well. I do apologize.
And our very own Michael Stott, who's Director of City Planning and Place, who's based in Brisbane. Welcome. We might give Fred a little bit of breathing space and have him relax for a couple of minutes. So we might start with the other panelists and circle back to you, Fred. We'll start with Caroline. Your public spaces team in New South Wales is leading some really exciting programs and funding opportunities for local councils who are interested in placemaking and rethinking street design. How can we incentivize placemaking that prioritizes human health?
Yeah, thanks, Princess. Terrific to be with you. Thanks, Fred, for a great presentation. I mean, I think Jenny, in quoting some of the work that we've been doing, it's never been more important. You know, I don't think any of us, when we leave our homes, will ever think about our environment in the same way, whether it's walking to public transport, walking to your local park, your local streets. We're acutely aware of the limitation of our bodies right now. I took the train this morning into Circular Quay, where I'm working today. You know, put on the face mask. You know, you can't but think about the importance of health in our communities. So I think that planning is essentially important. We've been doing a survey, as many of you know, and thank you to all those people online who have filled in that survey. And I think what we're hearing is that people are walking more. They're thinking about they're thinking about their local streets, they're using their local parks, beaches, trails, all the rest of it, and they're valuing them. So we are using that, I think, as a catalyst in many ways to bring forward a number of programs that we were already planning to develop. The public spaces team has been around for the past year only. About 2 weeks after starting this role, I was given the Premier's priority to lead. That's called Greener Public Spaces. And I think, Princess, to answer your question, all the programs that we're leading are about healthy placemaking. You know, that's the essence of what they are. Whether or not it's the Streets of Shared Spaces program that was launched, and then that funding round was announced in the last week. So much of that is about at the core of what we're about, and that's about walking. The Premier's priority is about walkability of our local community. Where can you get to within 10 minutes? So we're developing things like an online interactive platform so that people can work out what's within 10 minutes walk across New South Wales of themselves. We're developing a range of other programs, you know, the creation of 8 new parks for people across Metro Sydney. And then there's all sorts of other favourite programs of mine, like Everyone Can Play, how we can create inclusive play spaces, so often the kind of at the centrepiece of communities, that, you know, they're where all ages come together. And of course what we're focused on is free, open and accessible spaces. And I just wanted to end on the fact that, you know, we've done a lot of surveying in other ways, and the importance of public space to the communities never been clearer. So the department in the last couple of years did a community survey to tell us about your neighbourhood. So that was 12,000 conversations and collected 2,500 responses. And 75% of Sydney-siders prioritise 3 values: landscape, natural environment, culture and public transport. And I think we've seen all of that in Fred's you know, great presentation. And of course, I think for me, it is about the walkability and active transport and the distinctiveness of places. So health is at the centrepiece of those, and how we can really build walkability into daily life. I remember Brent Todarian posted this great, or talked about, you know, the thing in Australia and Canada and other places is that people often drive to the place where they exercise, or they drive to the place where they might play with their children. So how can we change that and build health? We will get health if we build it into daily life, so that it's not there for special events with a festival or whatever. It's 365 days of the year. And if we can manage to do that in the way that we plan and build and retrospectively change places, I think we'll begin to see that change. I'm not pretending it's easy, Princess. You know, and I think I feel that burden. I feel the incredible opportunity of the work that we're doing, but it's also a burden. You know, how we can get people out of their cars and walking, it is a challenge, but I think the team is up to it, and we're doing our best to really connect with communities to find out what they value, and I think that message is in as to what they value. So perhaps a roundabout response to your question, but for me it is definitely about walkable communities, I think, is at the heart of healthy placemaking. Thank you.
Patrick, we might turn to you and look at a more specific perspective of Southwest Sydney. We've heard from Jenny on the challenges already in Southwest Sydney, and even in more recent times when it's become a COVID hotspot. There was echo in somebody's background, so that kind of distracted me a bit. Particular health challenges in Southwest Sydney, and how can we perhaps address any of those health challenges through better built form design?
Yeah, so I'm going to talk very briefly about Southwest Sydney, and then I'm going to blow it out a little bit into thinking about the planning system, because that's my expertise. And also, if any of you follow me on Twitter, I'm a bit of a pest, so I like to stir the pot a little bit. I do think there's a positive story actually to be had in Southwest Sydney, which I will talk about a little bit. But if I start with the less positive issues, so the big health challenges in Sydney, I think, which Fred alluded to and Caroline just talked about, are really around chronic disease and disadvantage. So if you look at statistics, so if you're interested in looking at some of the stats that I'm talking about, there's a place called New South Wales Health Stats, which is a public place you can go and look at stats online. And you can see that there's something called preventable hospitalizations, right, which are conditions that are really around chronic disease, but also some other things that are that people are saying that you can, if you go into hospital, but it's considered preventable, that's a statistic that's preventable hospitalizations, and chronic disease, which I'll talk about in a sec, is part of that. And in southwest Sydney, we've got 4 suburbs that all have higher rates than the state, and quite significantly. And what's interesting from the perspective of built form and built design is that the challenge is how wide the definition of the built form is, so that you can capture addressing these really prevalent population-wide statistics around diabetes, et cetera, et cetera. So when we think about the built form and health, we often think about what we call preventable health issues, and those are at one level, and Fred talked about this a lot, at one level these are called lifestyle factors. So you've got being overweight, you've got physical inactivity, you've got diet and hypertension, and all those lead directly to those preventable hospitalizations that I was just talking about. But at a higher level than that, which Fred was also talking about, you've got something called structural disadvantage. And in the urban planning space, that really revolves not just around strategic planning, but also around infrastructure provision, right? So what happens in regions like southwest Sydney is that there's poor access to high quality spaces and places. There's fewer quality jobs in well-designed spaces and centres. There's limited public transport options. There's poor provision of public services, limited food options, and social connectivity. So this is like a melting pot of planning disaster and infrastructure disaster for people. So in a way, the built form kind of, it speaks partly to the context within which it's in, and that needs to be, as planners would know, is thinking about how we deal with those issues at scale, which is what I really want to talk about. And broadly, the evidence suggests that outer suburbs like southwestern Sydney are at a disadvantage in terms of investment, both in infrastructure and thinking about planning for the future, and the built environment and the built form that flows from all of this. I'll give you some quick examples about positive issues. So I do want to think about scale. In New South Wales, one of the best things we've had recently is Rob Stokes, who came along and basically changed the planning system for better, and people like Caroline coming along is part of that story. The legislation's also changed recently, which provides an opportunity for better built form locally. So we've now got a design-led planning objective, but I'll come back to that in the challenges in a second. And we've also got something called the Better Placed Policy by the Office of the Government Architect, which talks about health as the #1 priority. And then also, as I was just explaining, really breaks up the city into cities, to public realm, to buildings, to open space. So implementing those guidelines is a crucial thing for places like southwest Sydney. Going down a level strategically, we've got the Western Parkland City, which is providing a momentum for a focus on livability. And that's really become a proxy in the New South Wales context for healthy planning and healthy placemaking. Perhaps shouldn't be, but I'll come back to that in a second. And that's a great example of a policy shift to integrated planning, which is working across sectors and across silos that we're seeing in New South Wales as part of that 3 cities movement, and also thinking about transport planning as well as urban planning and infrastructure planning together. Also today, I was looking at interesting investment opportunities, and the New South Wales government, in response to COVID, has done a really interesting thing for our area. So planning approvals for upgrades to town centres in Villawood, and we're talking $300 million here, so that's not small change. And also to Fairfield, which is about half that, and 150 million. So that's a very positive story. And we've also got greenfield activities in places like Oran Park, which have been happening for around the last decade, but also an area called Wilton, which is a new area in southwest Sydney, which has also got potential, and there's going to be engagement, and there has been engagement with the health sector on both those things. Jenny's work in Healthy Places unit at southwest Sydney, I think, is a really great example of what can happen and what should happen. And also we've got these co-funded positions with council, which I think are really important. And Liverpool Council is just about to take on an urban design specialist, a healthy urban design specialist. So that's a really good story too. Just quickly, challenges. Years ago, we tried to get health as an objective in the land use planning legislation in New South Wales, which we failed when the planning legislation itself failed. And then design-led planning came along, which is great, but I do think it would be good to have an objective, which is an explicit health and wellbeing objective as part of that. Then I was also looking today at resourcing, and it's interesting when you look at the stats around investment in infrastructure. And there's a Western Sydney infrastructure plan, which is being funded, mostly federal, I should say, which is part of the difficulty of the story, for $4.1 billion, and it's all about roads. And what it says is that the infrastructure plans to provide better road linkages within Western Sydney region to benefit the region's growing population. Now, if you compare that to the Streets as Shared Spaces program, which is really important for placemaking, that's about $15 million in New South Wales. So you can see there's a misalignment with funding around infrastructure, which is road infrastructure, and Fred was talking about cars, and the idea of placemaking. And there's also issues around the federation and different sectors, etc., which come into that, but that's all part of the difficult story that Caroline was just talking about. Finally, I've got two last points. There are some major challenges in terms of changing public perceptions around housing and lifestyles, particularly in a place like Western Sydney. So I think there's a demand issue. I'm not clear that there's really out in the public, out in industry, or even in political support for the idea of better built form and healthy places. So increasing density and reducing sprawl are really important, but I think in people's mind, they still want houses built in the construction sector to keep moving along. And Fred was talking about some of that stuff around in relation to COVID and the economics of what's happening now. And finally, in terms of design and delivery, I do wonder if, and this spoke to Fred's last point about community empowerment, is often we're focusing on placemaking, but we're not bringing along the public with us in terms of the placemaking that we're looking at. And I think if you look at, there's some really interesting work that's happened over the last 30 years in New York called the Project for Public Spaces, which is a really good opportunity to think about how communities can be brought along up front and alongside policy endeavours like what we're trying to achieve. Thanks.
Thank you, Patrick. Really, really interesting thoughts in terms of the challenges in Southwest Sydney, but also promising in terms of the changes that are afloat. So look forward to seeing real positive changes in Southwest Sydney. Collaboration, experimentation. I know Caroline speaks a lot about experimentation. The Shared Streets grant program is one that is particularly interesting, I think, to see what comes out, whether we come out better in the post-COVID world. Michael, we'll turn to you, and like all these fantastic conversations on place, we really quickly run out of time. So we'll try and be as brief as possible. There's also heaps of questions coming in from the audience, so we want to be able to get to some of those. Michael, just thinking about placemaking, how can placemaking be used to create healthy communities? And how can we incentivize developers, the private sector, to embed the principles of healthy placemaking into projects?
Yeah, thanks, Princess. I think it's an interesting question, a two-part question, because I think the first part really is about, and what you've heard Caroline and Patrick talk a lot about is the kind of the physical well-being parts of it and the benefits from that. But of course, the other big part of it with embedding placemaking and creating healthy communities is the kind of psychosocial aspects of it, where we're looking at getting people together to create a shared purpose and an emotional attachment to place. And I think one of the things that we've come to see more so in the fore with COVID has been the limitations of architecture and the limitations of our neighborhoods and communities. And I think a lot of that has had a kind of a social effect on people as well. So not only are we realizing that actually, hey, perhaps we've prioritized vehicles too much in our neighborhoods and communities and there isn't enough footpaths, but we're also realizing that, hey, maybe I didn't know my neighbor before this and I didn't know anybody in my community. And I think one of the really kind of the both sad and happy outcomes, I guess, of COVID has been that, you know, there has been cases where people haven't had a network to reach out to, and have actually, there's been cases of people dying in isolation and different things related to COVID, which is incredibly sad. The happy part of that is that people are actually taking the time to get to know their neighbors and coming together and doing different things. We actually had a kind of a placemaking X event recently, which was called Porch Placemaking, which was across the world as kind of the biggest placemaking event. And that was all about, you know, with using social distancing, how can we use our front yards better, or our terraces, our gardens, our balconies better to kind of connect with people. So I really think that you know, when we talk about placemaking from a health perspective and a health and well-being perspective, and how do we use that to create healthy communities, we actually have to talk about what the outcomes we want for the social relationships, as well as the kind of the physical outcomes of having a better walking and cycling community. So in new communities, then, where we have these projects that actually do encourage social ties and connections, I think that we need to use the social connections and ties to create strategies which relate to physical linkages. And so we can't have one without the other. And I think for me, it's always, you know, playgrounds and recreation assets. You know, the idea Caroline touched quickly on was the idea of multi-generational spaces as the heart of the community, where we all can come together. I think is really both for kind of general happiness, but also this idea that nobody is being excluded from the space. And I think too, I'd extend that to saying that when we are building new communities, we have to think about the connections to and the benefits outside of our community. How do we tie into community assets so that we're not just building things in isolation, and not tying into things that are, you know, seemingly out of reach of the project? We need to make those our kind of assets. And I guess, you know, obviously with the health subject, you know, I think that there's this idea that, you know, but isn't it all very hard? And I think what we're seeing in the rest of Australia and around the world, with New South Wales leading by example, is actually it's not that hard. And there's been some really incredible examples in the last 6 months of decisions that are made for the benefit of all rather than the few, that are greatly shaping and changing what we value. And so I guess the challenge is really to empower communities and municipalities and the planners and different organizations that are captured within that, to feel like they can embed health and well-being and placemaking within the planning scheme. And I think that would go a long way towards creating these healthy communities. And really we need to get to the point where, with respect to the second part of your question, Princess, is that if we're relying on people to tell us what makes a good community, and we're just having a reactive approach to that, we've already lost. What we need to do is empower people to tell us. In the UK, they're doing a lot of things called place charters, where each community creates a place charter, and then the developer, there's no guesswork to it. This is what I need to deliver, and there's a metric to it. And I think we need to get better at that in Australia, in particular. And so instead of having this question, what kind of place do we want this to be? It's answered and built on by an empowered community and an empowered planning scheme. And I think leading out of that, just to keep it quick, is, you know, there's a 4-stage kind of thing that we need to do, which is raising awareness, defining the approach, exploring the value proposition, which you and I spoke about with the others in a previous conversation on place, and then advancing the state of practice in terms of how we plan communities, the planning schemes and policies. So there's a lot in that, obviously, to unpack around healthy placemaking, building better communities, and engaging developers to do it. But everything that I've read, seen, experienced, worked on is that early engagement is key. The community knows best, and we can't not start at that foundation, that fundamental place where putting that narrative up front takes the guesswork out of it, like I said, and helps us create healthier communities.
Thanks, Michael. And we're quickly running out of time. So I might bundle a bunch of questions for Fred that may be related, might not be related. There are 3 questions that are particularly interesting, I think. There's a question on how do you affect cultural change, particularly in rural and regional Australia, where driving is very much intrinsically linked to lifestyle. How do you address fear of crime? You were talking about safety. A number of these issues of fear of crime are not real. What are the things that we can do about that? And then the third question is on the aging of the population. With the aging of the population, how can we better engage with that demographic group so that we design places that are fit for them and we don't just deliver more playgrounds? Not that there's anything wrong with playgrounds. Fred?
Right, I'll do my best about this. The cultural change and lifestyles issue That's in relation to the virus, is it, or a more general one?
Just more general.
Okay. I mean, I think there are large amounts of cultural change that have been taking place in communities, and the way in which people's lifestyles have been adapted in all sorts of ways. I'm still getting my head around that new question. The fear of crime one, I think that is definitely known to be a case, which is that people, because of something that might happen in their neighborhood, there's an immediate response to sort of steer clear of it altogether, which is of course completely counterproductive in terms of, because it's much better to have people's, I think security consists of trust and people together, and majorities of people who are not involved with crime, and helping to make that something that isn't going to proliferate in any way. I think the aging of population is of course another huge matter, because of the additional stresses that it puts on the whole of our communities, because it used to be that people would get ill from diseases of all kinds that weren't necessarily the lifestyle ones. It was just to do with how things were, and they would die. They probably would be in a graveyard, and there wouldn't be any cost associated with looking after them. But since our amazing medical services now can keep people alive almost for as long as possible, it's a massive cost on society, and also the whole business of which jobs that creates, and are those jobs actually ones that are for that are productive, or they're much more, it seems to me they're much more to do with keeping people alive and keeping families happy to feel that their parents are alive. So it's I do think it's a very major issue. It's one that I'm no expert about whatsoever, but so I'll leave it at that. Thank you.
Thank you, Fred. And I just want to thank Fred London for joining us such early in the morning in London for your presentation, answering some questions for us. And I'd like to thank as well our panel of other experts, Michael, Patrick, Caroline, and Jenny. Thank you for joining us today. Before we wrap up, might just remind you of there's a couple of upcoming events that relate to conversation on the value of place. I hope you can join us for our fourth conversation of the value of place. This one is going to be focused on how do we create authentic places which engage and excite. We have on the board now, it's going to be on Wednesday, the 2nd of September from 1 to 2 p.m. We have a really interesting panel in there. It's going to be more conversation. We're not going to have presentations in that. It will be hosted by my colleagues Diane Knott and Jonathan Bryant, and that will really look at how do we design authentic places, places that feel real, that are genuine to our history, that tells the story of place, but that also feel authentic and exciting to the current and future population. And lastly, there's going to be another place seems to be, and healthy placemaking appears to be a really, really popular topic these days. There's also going to be an event coming up that's going to be hosted by Western Sydney Uni in October. Hopefully you can make it to that one as well. I'm just scrolling through my emails to see whether I can find the details of that. Oh, here we go. It's about prioritizing healthy placemaking, Western Sydney Uni Urban Living Futures and Society event in association with, there are a lot of acronyms here, SWLHD and WSHA and HUE Collaboratory. Hopefully some of you that makes sense, but it's on October 19th on a Monday from 2 to 4:30. And last but not the least, thank you very much for all of you who have tuned in today. will send a recording of today's event tomorrow. So in case you want to rewatch any part of that, or you want to share it with other colleagues or friends. Thank you again for joining us today. Bye.
Thanks,
Thanks,
Princess.
everyone.
Thank
Bye.
you.
Thanks, bye.
See you.
Bye.